My name is Agnes Montgomery. I'm a nursing student and I'm presenting this lesson to second year ADN nursing students who are going into the hospitals or healthcare centers to practice providing care to real patients. My topic today is infection control in healthcare setting. Infection in itself is a very wide topic, but my narrative for this particular lesson is about a doctor who defied all the protocols put in place. And while visiting one of his patients who had C. diff and was on enteric precaution, he did not wear gloves and he ended up being sick. The main idea here is one person was sick with C. diff, and the doctor came to visit her and he contracted the toxins. And let's get the scenario expanded. This doctor went and visited maybe 4 other patients. He touched them or he did not touch them. He passed something to them. And maybe these other patients contracted the C. diff toxins. And this is the whole idea of infection control. There are those protocols put in place. And I got this from the CDC website. I don't know if you can see it, but I would include this in my attachments for my students, not just this, but plus many, many other signs that show the different kinds of infections and how we can control them. I don't know if that's visible enough, but that's the best I can do at this time. And what I'm trying to reinforce to the students is that those protocols are time tested and they're evidence based. You do them, will be free of infections. And infections actually cost the nation, the US, for example, as a whole, a lot of money. Unfortunately, I did not put any statistics on this one, but we got so many different types of infections that can be prevented. For example, the patients who have catheters, urinary catheters, if they are colonized with uh, an organism, we can transfer that organism to another patient, or we can bring that organism from the very patient's body to the urinary catheter, and he will get infected. He came in with one condition, and we don't want him to have any other conditions that we can prevent. Most infectious diseases that we have in the hospital, they're called hospital-acquired infections, really can be prevented if only the people involved use the protocols that are laid down there. And here I'm trying to teach my students how to don PPEs, and of course I've shown them what types of PPEs there are and when they are used, and how to doff their PPEs, so that once they finish all that, they can be free of these infectious organisms as possible. It's not 100%, but what we talk about enteric precautions is there's nothing. Soap and water does not help. So once you're going to a patient's room, please wash your hands, PEPs correctly, go in what you need to do. When you come out, get these PPEs out in the right order. Again, wash your hands. And if we follow all these, I'm sure the cost of healthcare is going to go down, because infections in of themselves are very costly to get rid of them, to treat them effectively. And the more infectious diseases we have, the more we cross them from one person to another, the more these organisms get resistant to the medications that are there in the market now. And that means research is continually going on, because the medicine that worked for one patient yesterday would not work for the same patient today, because maybe that organism also has changed face. There's a medical word for it, so that it also is trying to survive. And so it's developing new techniques of surviving. I completely missed the word. But anyway, so infection control is a very important thing. It is not only in the hospitals, it is everywhere. We see patients in their homes, we see patients in the community. So we need to be cautious on how we interact with these patients. First and foremost is the universal precaution. Simply wash your hands, and that will go a long way. Thank you.